country. And guess what? That's the United States of America. So what we want to do is really get into the essence of what our healthcare system does and what it does not do. And we're just very delighted that on short notice we have such a great panel of folks who will talk about their experiences with the healthcare system and why it needs to be very significantly reformed. Okay? So let's start off on the left. Please introduce yourself.
Good afternoon. I'm Amy Fribbs. I'm a nurse, and I've worked in primarily mental health for many years and also with the elderly.
Good afternoon. My name is Angela Washington. I work at CFC in the cafeteria, and I'm also a member of Charity Mission Baptist Church. And I'd like to speak about the disparities of not having insurance.
Good afternoon, and welcome, Senator. I am Dr. Moheli. I'm an OBGYN practicing here in Charleston, and I'm very happy to be here.
Hello, I'm Stephen Barnett. I'm the medical director at Can Community Health, currently located in Columbia. I'm a family physician and have done my entire career in underserved areas, first rural, now inner city. I'm happy to be here.
Good afternoon. I'm Susan Burrows. I'm the Chief Operating Officer at Kershaw Health, located in Camden, South Carolina. I've worked in healthcare from the West Coast to the East Coast, and I'm excited to be here and have the discussion.
Good afternoon. I'm the Honorable Stephanie Ganaway Paisley. I'm a retired summary court judge. I'm currently a psychology professor, and I live in Charleston. It's a pleasure to be here.
Hello, my name is Mary Ellen Smith, 27 years old, and I'm a community activist, social and racial justice activist, and a firm believer in Medicare for all those Americans across this country.
Okay, let me start off with a simple question. How is the healthcare system here in South Carolina? Everybody got coverage, quality care at an affordable cost? We're doing a good job on disease prevention and more. Prescription drugs, absolutely affordable?
No.
It's not the case, please.
Well, as I said, I work for the College of Charleston, and I can't afford insurance that is being provided through the corporation that I work for. And it is hard for me to get around to get the basic medicines that I need because I rely on public transportation. The few places that offer these services are so far away. And no, I would, before going and paying a large co-payment that I can't afford, I would call my mother in Memphis to get her home remedy first because I need to work and I just can't afford it. South Carolina does an awful job with the health care.
Now, the point that you made, and it is not made often enough, we talk about people who have health insurance or not. Just because you have health insurance does not mean that you're home scot-free. Doesn't mean that you can afford to go to that. You got deductibles, you got co-payments, etc. Who wants a doctor? You want to talk to that one?
Yeah, I'd love to. That's what I was going to say. We have plenty of uninsured people in South Carolina. On top of that, because South Carolina didn't expand Medicaid, we have people that don't make enough to do ACA, which is if you make under the poverty level, then you have to go apply for Medicaid and get rejected. So they're still uninsured. Personally, and I'm sure you guys can all attest to it, most people have a minimum of a $2,000, $2,500 deductible, which has climbed greatly, and a $5,600, that kind of for out-of-pocket maximum. So you don't want to get me started on private insurance, but having private insurance doesn't always help. And one of the things that we don't see when we're employed with private insurance, the real cost of that. We in this whole Medicare for all debate, I've never heard anyone say, they always say how much it'll cost, they never say how much we're putting into the private insurance industry, which basically with their overhead and profits, they're keeping about 90% of our premiums.
Okay, further discussion.
I'd like to talk about mental health. I think that is one area that is ignored a lot and not given a lot of attention to. I believe that most of you all that's from Charleston know that I ran for Charleston County Probate Court Judge, and my main concern was making sure that people who have been diagnosed with a mental illness get the dire treatment that they desperately need, and that is not being done. And I think a lot of attention needs to be brought. We need to look at interventions and prevention when it comes to mental illness. It is better to treat before the disease becomes chronic. We need more research. I think that we need to put a lot of attention on mental health, and that and having insurance does not always afford a person the opportunity to be treated with a mental health illness.
Judge, let me ask you a question. If somebody is, say, a low-income worker and has a mental health issue, what do? Are they able to get treatment?
It depends, Senator. I don't think so. It depends, really. I think that when people have low income or that's socioeconomically challenged, they're not getting the treatment that they need for mental health. Even those with insurance, sometimes the disease or whatever diagnosis that person has is not always covered by the insurance.
Okay.
Can I say something to that?
Yes, please.
Go ahead.
One of the things I wanted to share
Talk a little closer to the
okay. One of the things that I wanted to share is for my facility, what we've done is partner with some of the local community clinics to be able to provide services for those that cannot afford care, so that they're still seen, they're still receiving great care, great services. And I think we don't see a lot of that innovative kind of conversation talking about how can we partner with one another instead of operating in silos and still have people treated and receiving care. So I think that's something that we need to look at as well.
Okay.
I would agree with that. The South Carolina Department of Mental Health has reached out to communities that are lacking in mental health resources, and I think those things have helped. But there still continues to be a big gap in that area for the resources. It's a vulnerable population. It's not one that people are going to be speaking up about. It's not a population that typically has a lot of money or resources. My friend I just met here, neither one of us really prefer to drive, and she doesn't drive at all. And to get to some of these different clinics and so forth, and the medications that we've talked about, very expensive. And I just think that if we don't take care of the people with mental illness, and I'm including kids in this, we have one of the highest rates of suicide today within our teens. How sad is that?
I'm sorry. Were you done? I'm sorry.
Yes.
No, I want to speak on the amount of the outrageous prices of drugs that affect every single one of each and every American. With rheumatoid arthritis with myself, my medications cost $3,000 a month. I don't think any of y'all got that laying around just a send off as a bill. And I just want to highlight a few of prescriptions I picked up today. They got my name on it if you don't want a fact check. But no, I picked up a prescription for sleep aid, which is also considered an antipsychotic, which deals with schizophrenia, but I just use it for sleep, but some people need it for more reasons. The original retail price, $538.89 for a 30-day supply. Another one, for pain, $125.89. I solely live off Social Security disability. That pays me a little over $800 a month. How am I supposed to cover these medications and live a life and pay bills and just have a roof over my head and food in my stomach? It's just an atrocity.
Let me jump in and ask a question. Maybe the doctors want to answer, anybody else. Picking up on Mary's point, if one doesn't have the money to see a doctor, and one is ill either with a physical illness or a mental illness, let's be frank, what is happening to those people? What happens?
Well, I'm an OBGYN, and the thing that really shocked me is the fact that in this whole country, South Carolina state, we unfortunately happen to be last in the areas that we don't have to be. Charleston itself, we are on the bottom as far as infant death, infant mortality, as far as availability of healthcare resources. You won't think it is so. I mean, when you drive through this town, there's hospitals everywhere. But yet, people who are not insured, low-income people, people of color, don't have availability to the healthcare resources that we have, especially women. And this has been a major, major issue for the American College of OBGYN. And you all are aware of the reasons. Of course, it is educational, it's financial, it is availability, it is the big coverage gap. People cannot afford it. And South Carolina State was given the opportunity to expand the ACA, which will cover that gap. So my question is, why wasn't that taken? So I see a big a disparity between those that think they have it and those that don't have it. We are all in this. The only way we're going to solve this is if we come up with a win-win solution, because Walmart cannot be able to operate if the workers are not healthy, they don't have insurance, and they don't show up there. So goes for a lot of other entities in this state, Boeing and the rest of it. They won't be able to work if we don't insure everybody. Therefore, I really think the policymakers need to really get their act together. And that's one of my pet peeves and being here today is we have the resources. As the senator mentioned, we are the only country in the world that does not make health care a priority, even a right. Every other country, down to the third world countries, we have we say we are superpowers and we operate as a third world country in our healthcare system. There is a problem. It's not going to be solved yet today, but we need to come together. We need to listen to each other. We need to have a solution or a revolution, as the senator has said.
Mm-hmm. Doctor, what is your experience with people who are uninsured or underinsured?
It is, I'll tell you in a nutshell. In my practice over 25 years, I've always accepted people, any type of insurance and without insurance. I had to close my doors 2.5 years ago because no one else, and I don't fault those providers when they can't afford to do that. So what happens is they end up, but even all those people I took, I could provide what I can provide as a primary care physician, but if they needed a CAT scan or an MRI, I had no power to get that for them. There are programs set up in hospitals that try to do indigent care for sliding scale and so forth. The reason all that exists is because there's so many people that are uninsured or underinsured. It's a simple solution. If everyone had Medicare, you wouldn't have to have that program. If everyone had Medicare, we wouldn't have to have all this funding for Ryan White for HIV and all these other things, disproportionate share for hospitals, millions and billions of dollars. Everyone would be on a level playing field. These people that are insured now get episodic care in the ERs, or typically because the hospitals, will not turn people away, but they're coming when so many things could have been prevented, and the follow-up never occurs. Right. Once they're discharged, they're in the same situation.
Right. Would I be correct, and anybody can jump in on this, would I be correct that if a person is either uninsured or underinsured, they are going to hesitate going to the doctor?
Oh,
Oh, yes,
Absolutely.
absolutely.
You are correct.
Yes.
All right, who
And
wants?
even those
Absolutely,
insured-
100%.
Well, one at a time.
correct.
Okay. Okay, Mary, briefly. Yep. Did you want to?
Yeah, and so for the folks that I know that are underinsured or have no insurance at all, they rely on these charities around town here in Charleston and, without South Carolina. And the only way that they are only going to receive the most beneficial care that they can at the time is to just go through these charities. And there's a lot of paperwork, a lot of, time passing on until you're approved to finally go see the doctor. I was one of those at one point.
All right, let me
definitely, yeah.
Let me go to other people. Is it common that if somebody has no insurance or is underinsured, that they hesitate going to the doctor when they in fact should?
Absolutely,
Absolutely.
Senator.
Okay.
I'm going to tell you for a fact that I do not go to the doctor because I cannot afford a copayment. And I am the one that does go to these charities, and you do have to fill out a lot of paperwork. You have to have your birth certificate and your state ID and all kind of other things to get these free limited stuff. And then you're also put on a waiting list. So before I do any of that, like I said, I'll call my mother and I'll find a home remedy because I have to work. I have to eat and I have to pay bills.
Okay, further discussion on, I've talked to doctors in Vermont who tell me that patients walk in the door much, much sicker than they should, and sometimes they lose those patients. Is that something that's happening here?
Absolutely,
Very
especially
true.
in the hospitals. When you get them, they're almost a train wreck because they've not had an opportunity to have that preventative care. And rightly so, some of them would rather keep their lights on or feed their kids and do all of those things with the money that they do have before they pay that money to go to the doctor.
I agree, and I don't think you should have to put your health off, to pay a light bill or to buy groceries or to make sure your children are have clothes to go to school. I think health care should be a priority in the fact that our government need to make sure that our citizens have health care so that we can be taken care of. Our health is very important. Like you said, Senator, if someone is ill, or doctor, if someone is ill, they cannot go to work. They cannot maintain their job. Right. We need to have good health care. We need to have preventative health. We need to have prevention. And we need to be able to be diagnosed early so we won't have to worry about a cure versus trying to, what they say, an ounce of prevention is better than a pound of cure. Right. And Representative Gilliard and I have talked about this so many times, that health care is so important to the citizens, and for some reason, we don't want to address it and fix the problem.
And I think...
Yeah, go ahead.
I think, too, it's a little uneven. Not to say that as I'm getting older, that I don't want health care and I don't want to be able to treat it appropriately within the hospital setting, but I see so many tests and everything done on our elderly at this part, but maybe if we had just done it at this part, they wouldn't be there now in their older years. If we had just taken care of their basic needs and their basic health needs a long time ago, maybe they wouldn't have been that train wreck that comes into the ER.
I've seen us talk a lot about the problem. I think everybody knows the problem. We all do. Even the baby that was born today knows the problem. So what I want is solutions.
Yes.
One very good solution is just down the street. It's called Federal Clinic. We need more community health centers, federally funded community health centers. So everybody can go in there and feel comfortable. I've worked, when I first came to Charleston, the first place I went to was the community health center. When I was in Texas, I was at the community health center. I enjoy it, I love it. It's a place to really reach your community, and it's a place where you get known pretty quickly too. And it's a place where you touch and reach people and you treat them, not because of what their status is or their money is. So we need more community health centers. They should be like one, this is the holy city, right? Let's have holy community centers.
Well, let me just jump in here because you're touching on an issue dear to my own heart. It turns out that in the Affordable Care Act, Representative Jim Clyburn, your representative here in South Carolina, and I worked to double funding of community health centers, and many millions of people now have access to health care who didn't before. And by the way, just so everybody knows, and in my state, like 1 out of 4 people in Vermont utilize community health centers for their primary care. Community health centers provide primary health care, they provide dental care, they provide mental health counseling, and they provide the lowest cost prescription drugs available in the country. So actually, I'm happy to tell you that Representative Clyburn and I are working right now to substantially increase funding for the community health centers so we get more people into them. Also, we are working on substantially increasing funding for the National Health Service Corps. That is a federal program which says to people that if you're a doctor or a nurse, dentist, if you are prepared to practice in an underserved area, we'll forgive your medical debt. And that has been quite successful. So we're going to work on that as well. I just wanted to pick up on that point. Let me skip just a little bit. We've talked about mental health issues, and God knows that is not an issue that we talk enough about. It is a real crisis, I think, in every state in this country. Do we here in South Carolina have enough psychiatrists, psychologists, counselors? Who wants to?
No, absolutely not.
Okay.
No, we don't. We have to utilize a lot of telepsych services, and that's really helped all of our hospitals. In Kershaw County, at my hospital specifically, we opened a geropsych unit, a 20-bed geropsych unit, and we were able to recruit the psychiatrists out of the state because there were no psychiatrists available for us here in the state.
So there are, in your judgment, not enough psychologists?
Not enough.
Yes, sir.
If you don't mind, with the current healthcare system, there's a huge and growing shortage of primary care physicians as well. Going back to community health centers, they're great. One of their main purposes for being here is to help those without insurance and underinsured. They do a sliding scale. They get federal funding. We have the same in our HIV clinic that we run. You can get funding through Ryan White to help the patients. To me, the key is if everyone had Medicare, that would replace a lot of that funding that has to go to pick up all the gaps. You know, we'd all be on a level playing field. Doctors would have one insurance company the stress of our job is dealing with, it's not Medicare and it's not Medicaid. It's dealing with all the private insurance. It would make our lives easier. It would make the patients' lives easier. The drug issue is because there's probably 120 different drug formulators that we can't keep up with. And that's that smoke and mirrors that the private industry is doing that makes us think we're getting something for our money. When you said that drug costs $500 and something, I don't know if you have insurance, but if you do, they didn't pay $500 and something.
Yeah, I do have Medicare at this point, and the retail cost is that, the $500 something. Right. When I have my rheumatoid arthritis medication drugs, which I have been deemed legally disabled, those drugs cost $3,000 a month.
Right. So if you didn't have insurance, you would have to pay $500 and something a month. Medicare, whoever does the drug payment from insured, pays maybe $100.
And I'd like to get back.
Let me just jump in here for a second. I heard. I remember a few years ago talking to a doctor in Vermont in a working class area, and she said, Bernie, I write out prescriptions, but a lot of my people cannot afford to fill those prescriptions. And the national statistic is, I believe, that 1 out of 5 people who gets a prescription from their doctor cannot afford to fill it. Am I missing something, or is that totally insane?
It's probably
It's
worse.
totally insane.
You think it's worse?
Yeah.
You 100% right, Mr. Bernie.
Okay.
That's true.
Okay.
Senator,
Yeah.
I would like to proudly say that I'm a product of public health service scholarship. And when I finished from Tufts University with that scholarship, I went to Texas and I practiced in small communities, and it was a joy of my life. And back here, question. Public Health Service and National Health Service Corps, I believe, still exists.
Yes.
why are we not having an overflow of these physicians in the rural areas, in South Carolina, all over the place? What is going on with the program? I mean, I don't understand.
The program does, we doubled, Clyburn and I actually substantially increased funding. That was, I don't know, 5 or 6 years ago. But we need to do much more. Would I be correct in saying that in underserved areas, rural areas in the state, there are just, it's hard for people to find a doctor? Is that correct?
Yes, that is
We
correct.
had 5 physicians for 48,000 people in our county.
My God.
I did it through the Office of Rural Health of South Carolina, and I stayed there. Those counties that need us are the ones that have that same problem, so many uninsured and underinsured patients, that once you finish that, I stayed, I was able to until we couldn't stay anymore because so many people couldn't afford their meds, the hospital has closed because of that just in October. It's because there's so many people without insurance, and it would solve so many problems. I can practice, a lot of doctors would like to practice in Winnsboro, South Carolina, but you can't afford to because there's no program in place to help the people there. There's and the need for health care is even higher per person, just like it is where I practice now for HIV patients. About 50 to 60% of our patients are uninsured.
Dr. Mugelli, you said earlier that this almost sounds like a third world country, doesn't it?
The way to practice medicine, yes, it is. With all, it just, I'm always dumbfounded. I was saying to myself, we don't have to be running overseas and jumping in the airplane doing missionary work. Missionary work is right here. We have sufficient missionary work right here. So let's do our missionary work here first. When we're done here, we are too rich, we are too intelligent, we are too educated, we are so blessed. What is the problem?
Okay, good question. What is the problem?
I know we've not talked a lot about social determinants of health, but it could be that we've got providers in the area, but there's no transportation services for them to even get to the appointment. So the further they live out, the more difficult it is for them to even get to care.
And to piggyback on that, and myself being involved with Low Country Transit Organization with Jack Hamilton over there in the crowd, he has been fighting very, very hard to have adequate transportation from Somerville all the way downtown to have a bus rapid transit system so people can freely get on this sort of transit system and get all the way downtown to where the medical university is and go to their doctor's appointment.
You're absolutely right. Transportation in Vermont, and I suspect in South Carolina, is a big issue. But I'm going to throw that question out. Let me be provocative. Why is it that 50 miles away from where I live in Burlington, Vermont, in Canada, people walk into any doctor's office they want. They don't have to take out their wallet. They have cancer surgery. Doesn't cost them a penny. It's paid for publicly. Why is we the only major country on earth where...
Greed.
All right, the audience, I think, has the answer.
1%.
Yeah.
Okay.
It is greed.
All right, panelists, what do you think? I mean, now, just to be a little bit provocative here, I think you all know that insurance companies make billions and billions of dollars in profits. The guy who is the head of United Health, if my memory is correct, made over $80 million in financial compensation in 1 year, I think in 2017. So we have a system in which insurance companies and drug companies make billions and billions of dollars, and yet you got tens and tens of millions of Americans who cannot afford to go to the doctor. To me, that is pretty crazy stuff, and is not befitting of the wealthiest, most powerful country on earth. That's my view. But other people jump in.
I think we need to really address this abundance mentality. The truth is that there's enough for everybody under this planet's Earth.
Yes.
Okay? I don't need to usurp and take all the oxygen in this room. It's enough for me and everyone in this room, everyone everywhere. Somehow we need to meet with our great companies and great institutions and say, listen, we need your help. I think we need to figure out a way where we can communicate with them and say, look, we're not accusing you. We're very happy you're so wealthy and so rich. However, we need assistance from you so we can help you get richer. We need a win-win situation. We need to convince them. We don't need to anger them. At least we need to try that more. From the policy senator is doing that, and many more need to join him and approach this mega $trillion, giga, whatever it is that they have. So put some of it back. There's joy in doing that. If we can do that, then I think we will succeed. Otherwise, I see this country going down the tubes. Question here is, in the next 30 to 40 years, we're going to have increase in the uninsured, increase in the people of minorities, people of color in this country. The healthcare crisis, if we don't deal with it now, is going to get worse.
Oh, yeah.
Okay, what I want to do now is open it up to our audience, and we thank all of you for coming on such short notice. Questions, comments? Yes, ma'am. Your name is? Sharon.
And I was disabled.
Stand up, if you could, please.
I was disabled after I had some lung surgery, and I was on disability for 2 years. I didn't realize that after that time, I would be switched over automatically to Medicare. And because I'm not 65, I'm not allowed to buy a supplement for Part B, which is everything they do in the office. So, and in my condition, that's very likely. So I went from having Obamacare, which was wonderful, to having Medicare, which is horrible. One prescription that I have to have is $225 a month, and I'm trying now to go through their company to get a reduced rate or something, but it's very hard and very frustrating, and I don't understand that part at all, and there's many more, I'm sure.
Okay, other thoughts or comments? Ma'am, right here.
Hi, my name is Dorothy Smith.
Dorothy.
I have a lot of comments. Okay. Number one, I done had plenty insurance like she's saying. None of them don't help. Now I'm on Humana. Humana won't even help me. They don't even give you dental coverage. Right now, medication is so high. If I had to, girlfriend, my bill would be higher than yours. I thank God for everything, and I thank God that y'all better vote this man in right here.
Thank you.
Okay, gentleman right there, sir.
My name's William Hamilton. I'm legally blind. I've never been able to drive. I'm on Obamacare with my wife and my son, and it's a great relief because Julia lost her ability to work a few years ago. I rode the bus to your rally last night in Charleston. I had to leave early because there was no way to ride the bus home, and since I run the local pro-public transit organization, I have to ride the bus. We've got enough hypocrisy in America in the White House without me adding to it. The reason that we have bad transit that makes it hard to get to medical clinics is also the reason that it was hard for me to go to your rally last night and impossible to stay till the end. There are a lot of oppressed people in Charleston.
Yes,
our transit system and our medical system are not accidentally bad merely because people are cheap. They are bad because they are instruments of control and power, just like the schools are. The goal is to make sure that a person that doesn't feel well or is poor or works a regular job can't go to a Bernie Sanders rally because they might hear something they like. They might meet somebody like Mary who can help organize them or at least get them excited. They might meet a lady like this lady from the College of Charleston who shares their problems. And then they'll get organized, and then some white-haired senator from Vermont will get them in an organization, and pretty soon they'll be ganging up on the people that are oppressing them. It's not an accident. It's done on purpose.
Well,
we have
just
just enough health care to keep the workers alive, just enough transit to get them to the cotton fields.
I did want to mention that the idea of Medicare for all, comprehensive care, covering all health care needs, a few years ago was seen to be a radical idea. Turns out now that in poll after poll, a majority of the American people support that idea. So we are making some progress. The House of Representatives, I think, has over 100 co-sponsors on a Medicare for all bill. I have, I think, 15 or 16 in the Senate. So we are making progress, and I think more and more people understand that health care is a human right. You know, it's not a privilege. Okay, sir. Yeah.
Yes, I'm Harold Gettings with Sheet Metal Workers Local 399, and I'm just glad to hear that mental health is actually being addressed in this whole issue. Yeah. Because I have seasonal affective disorder and borderline personality disorder, and I'm off my meds right now, which is probably not a good thing for anybody here. But
why are you off your meds? Because you can't afford them?
No, what it is like the insurance I get through my union, it in theory covers mental health, but good luck finding a provider anywhere locally that's going to actually take that. So it's either take a day off of work, drive halfway across the state to find a provider that's going to take my insurance, or just work and deal with it. And that's the choice a lot of people in this state are facing, and I'm glad that it's being addressed.
Thank you very much. Yes, ma'am. Yeah. Hey, why don't you get that mic right there?
I'm an ACLU voter, and one issue I really care about is women's reproductive rights. And I know Dr. McGelly touched on that and said that women's health care in general is often really overlooked. And I want to thank all the panelists for coming out today and talking about it. But I want to ask Mr. Sanders, you personally, how, as a possible president, would you make sure that every woman in this country, no matter their color, no matter their socioeconomic status, has access and has the right to choose for their own body?
To me, this is an issue I've felt strongly about my whole life, and that is the decision regarding abortion must be made by the woman and not the government. And I have always found it interesting that many of my conservative colleagues, they always say, get the government off our backs. If a factory wants to pollute a river, leave them alone. Let's deregulate that. But in terms of maybe the most personal and difficult decision a woman has to make, suddenly you got local, state, and federal government telling her what she should do with her body. And I resent that very, very much. Yes, ma'am. You're getting a mic right there.
Hello, it's a pleasure to be here, Senator Sanders. My name's Angela White, and I am a server at a local restaurant, and so I deal with lots of people that either are underinsured or have no insurance. And we talk a lot about things, and the most common thing that people say when I talk about you and your campaign, not everyone, but it's great what he wants, but it couldn't happen. So in terms of the health care, could you speak a little bit about how we would take our broken health care system and transition into all of this wonderful universal health care, please?
Good.
Thank you.
One of the reasons, you can you can provide health care to everybody in a variety of ways. That's true. To my mind, the most cost-effective way is through expanding Medicare. Medicare right now for older people is a pretty popular program. It's not as strong as it should be. It does not cover dental care, doesn't cover hearing aids, doesn't cover eyeglasses, and we want our legislation would cover that. But the reason we have introduced legislation expanding Medicare is that people are already familiar with Medicare. So right now, for those of you who are 65 years of age or older, you got Medicare. God didn't create the situation that for people 65, you got it, people 55, you don't. Okay? So what our legislation does is it phases in Medicare for all over a 4-year period. First year, you go from 65 down to 55, and we cover all of the children in that first year, and then we continue to drop it until everybody in America is covered. Now, the doctors didn't talk about it, or we didn't get into that, but the reason that we end up spending so much more per person on healthcare is it is an administrative nightmare. You got hundreds of insurance companies, and you have people having to figure out what kind of coverage you got. Are you covered? Are you not covered? And we're spending billions of dollars in paperwork. And once you say healthcare is a right, you are going to get all of your basic needs. You simplify and reduce the bureaucracy very, very significantly. And then we have money to put into doctors and nurses and disease prevention rather than just bureaucracy. And the other reason, let's be frank, at least in my view.
Senator, I want to
Go ahead.
address the young lady there for the question that she asked. I would like to say that the American College of OBGYN has been working vigorously for years, especially I think it was 2017 and 2018, when they tried to remove the rights of our patients to be able to control their own contraceptive program by taking away simple things like birth control pills, able to go to Planned Parenthood and decide what you want. I'm a Christian. I don't believe in abortion. I'm also a physician. But I don't have control over any individual, not even my children, not my wife, and definitely not my patients. This is what happens. I can give you a very quick scenario. Okay, you take away the birth control pill, you take away the IUD, then she gets pregnant, then this is her third or fourth pregnancy. She cannot afford it. Then she has an abortion. Then you have complications with the abortion. Now the child is born after going through all this, and she wants to give it up for adoption. And you're not going to adopt the child. And you're not going to provide the Medicare or the insurance necessary. What kind of a vicious cycle is that?
Yeah.
Does that make sense to anybody? Now, they try to put a wedge between us, physicians, and our patient by bringing in some religious excuse. And I call it an excuse. I'm sorry. I don't advocate, it's an individual thing, very personal. It's a spiritual thing. However, we have to provide the care, and we cannot deny care to thousands and thousands of women, especially women of minorities of color. 60% of the non-insured women in America are people that are low income, non-insured, and they are suffering and they're dying.
I would like to add in something. To my knowledge, there are no state or federal monetary appropriations, donations that are given to any sort of abortion clinic. Abortion is a woman's right to choose, and that is what it will always be.
Okay, other questions? Ma'am, right here, yes.
Hi, Senator Sanders. Thank you for coming. My name's Laurie Beckman. I ask a lot of questions, and I like that you keep saying why. You got, I think, your answer from most of the audience. Greed is pretty much the bottom line for this mess that we've gotten ourselves into. But then I like to ask, well, how did we get there? How did we get in a situation where greed is controlling the health and welfare of everybody in the country? And every other developed country in the world has standardized, nationalized health care, but we don't. You know what else they don't have is an election system like we do. We have got to get money out of politics. 95% of the 535 members of Congress are there to enrich themselves. Maybe they started out as idealists, but you can go online and see where they're getting their money. Bernie's not on the list, by the way. We've got to change the system.
Yes. I think you make a very good point. The bottom line is, and I don't want to get off our healthcare subject, but in Congress right now, you have an entity which is absolutely beholden to the wealthiest, the most powerful people in this country. Now, if you go to downtown Charleston and you ask people, for example, do you think it makes sense to cut Social Security and give tax breaks to billionaires? What percentage of the people that you talk to would think that's a good idea? Very few. Yeah, very few.
1%.
And yet, that is exactly, what my Republican colleagues are trying to do. Why is that? Well, for the very wealthiest people in this country, for whatever reason, your point, and this, we need some more psychiatrists to help us out on this one. You would think that if you were worth a few $1 billion, you would not stay up nights fighting for another tax break, right? You would think you might have enough money to just get by. But they do. And that is the greed that we have to take on. And your point about an election system right now in which billionaires, Koch brothers, spend $400 million to buy candidates of their choice. And then you have governors working on voter suppression, making it hard for poor people or people of color to vote. You got extreme gerrymandering, you got all that stuff. And this is the part of the moneyed interest trying to protect themselves, in my view.
And
Yes,
Senator, if I may add, there's a term in psychology that we use which is called social comparison. The more we have, the more we want.
But I'm going to throw it back to you. Don't you think that if somebody had a few $1 billion, they would not be having to spend money trying to buy candidates to get them even more in tax breaks? Don't you think?
I think.
I mean, it's hard for me to understand. I mean, everybody wants to be secure, and I understand that. All right, gentleman in the red shirt.
Thank you, Senator Sanders. My name is Taylor Allred. I'm co-facilitator of Charleston Democratic Socialists of America. Thank you for being here. Longtime supporter. I wanted to ask you, in your Medicare for All bill, would you support including an overhaul in the way that the Indian Health Service is funded? I understand that currently Native Americans are receiving only a third as much money in health care services per capita as the rest of America. And it's having serious consequences. Right now, the life expectancy for men on the Sioux Rosebud Reservation is only 47 years.
Oh, wow.
The answer is yes. The truth is, in general, the way we treat the Native American people is a disgrace. And the healthcare system, it parallels that, and that's got to change, absolutely. Yep, gentleman in the blue hat.
Hi, I'm Dexter Blanchard, and I'd like to bring into discussion, after watching what happened with Obamacare and the opposition's attacking of it and trying to destroy it at all costs, I believe President Trump said he would do anything to destroy Obamacare. With your plan, how are you going to avoid the opposition or the right in Congress and the House destroying the bill?
I'll tell you how. I didn't mean to be too political here. I wanted to stay on healthcare and not. We had a rally yesterday. That is on a rally, but this is my political philosophy, and that is the only way you take on powerful special interests. And understand this: that within a short period, unless I'm very mistaken, you're going to see a lot of ugly 30-second TV ads attacking me and attacking anybody who supports Medicare for All, all right? The insurance companies and the drug companies have unlimited amounts of money, and I use that word advisedly. Unlimited. Give you one example. This will blow you away. A couple of years ago in California, the folks there had a modest proposal, put it on the ballot, to make sure that state government didn't pay any more for prescription drugs than the Veterans Administration, which purchases drugs at the lowest cost in America. Who wants to guess how much money the drug companies spent in one state on one ballot item? Answer, $131 million in one state on one modest ballot item. How much do you think they will spend in the effort to prevent Medicare for All? Now, to answer your question, this is what I believe. I believe the only way you take on the insurance companies, the only way you take on the drug companies, the only way you take on Wall Street, we didn't talk about climate change, the only way you take on the fossil fuel industry. These are all enormously powerful entities. The only way is through a political revolution. And that means millions of people standing up and saying, you know what? My children and I are entitled to health care as a right. And anybody who does not support that proposition is not going to get my vote. And I am going to register to vote, and I am going to vote. So all of these things are connected. Yeah. Yes, sir.
Hi, my name's Nick. I'm also with Charleston DSA. I have a question for the panel, but also for you, Senator Sanders. One thing that I believe hasn't come up very much today, but which is one of the major gaps in the American healthcare system, is how we treat long-term care for the disabled and elderly. So my question to the panel is, what is your experience with that in South Carolina? And then my question to you, Senator Sanders, is how would your bill address long-term care?
Thank you. Excellent question. Who wants to jump in on that? Long-term care.
Doctor.
Okay. Let the doctor start.
Long-term care, which I've done as part of my practice for 20 years, Medicare currently only pays for the short-term rehab portion. Therefore, in order to get help with that, you have to, if you're for long-term care, which is the big demand right now, you have to be able to qualify for Medicaid or pay private pay. Hopefully, again, in order to combat that, we have to get the savings from what we're wasting in private insurance, wasting in administrative costs, mainly for private.
Can I just excuse you, Doctor, for a second?
Administrative costs.
I think it goes back to, if we can't take care of our kids today, then how do we think that they're going to take care of us when we're old?
Yes.
All right. Let me apologize to you all. I've got to catch a plane. I am sorry. But I wanted to thank our panelists for a serious discussion on an issue that I think does not get enough discussion. I think we could have gone on for a couple of hours, and I want to thank all of you who came here today. Let me just end this discussion by saying this. We are winning this fight. More and more Americans understand that we have a dysfunctional healthcare system, but the opposition is very, very powerful. So let's continue our effort to rally the American people so that the day comes sooner than later when everybody in this country can go to the doctor anytime they want, and when people who have to go into a hospital know that when they get out they're not going to be bankrupt. I don't think that that is a radical proposition. I think that's what we got to do. Thank you all very much.
Thank you. Very much. Thank you.
Oh, I can't do that. I'll do that on electronics.
Before he jumps on the plane.